everyone, my name is Brooke, and today I'm going to talk about the cause and effects of Alzheimer's disease. 3% of every 1 million people are affected by Alzheimer's disease. This does not include the caregivers, the family, and medical professionals that are also affected. Did you know? The common healthcare diagnosis that most of you know as Alzheimer's disease, or referred to as dementia, was first diagnosed back in 1906. According to the Alzheimer's Association in 2016, 15.9 million family and friends provided 18.2 billion hours of unpaid assistance to those with Alzheimer's disease, adding up to a nation's value of $230.1 billion. Two-thirds of caretakers are women. There is still much need for research, resource, and assistance for these people and their families being affected by this disease. The first diagnosed case of Alzheimer's disease was in 1909. The psychiatrist who first diagnosed this case was Alois Alzheimer's. The patient who was first diagnosed was Augustus D., and he was only 50 years old. During the next 5 years, only 11 cases were noted to be similar. 6% of people over the age of 65 are affected by Alzheimer's disease. Some of the top leading causes of death in the United States are diabetes, heart disease, cancer, stroke, and Alzheimer's disease is fifth. Even though there is no cure, there are many reasons as to why Alzheimer's disease is so common. Some of these risk factors that are associated with Alzheimer's disease are age, environment, poor health, and diet. The number one risk is age. Most individuals with this disease are 65 and older. 1/3 of people 85 and older have Alzheimer's disease. 1 in 9 people 65 and older have Alzheimer's disease. Poor dental care and cell death of tooth nerves can lead to memory loss and confusion. The most common bacteria found in the brain with people with diagnosed Alzheimer's disease is called Poriformis gingivitis, which is caused by poor dental health. There are foods that can impair and foods that can enhance memory loss and brain cognition. According to the Alzheimer's Net site, our brains need healthy fruits, vegetables, and lean proteins to increase cognition function. When people fill their body with breads, pastas, sugars, processed cheeses, and cold-cut meats, they are spiking their sugars, leading to inflammation of the brain. The brain then has a cognitive decrease. Many people live many years in early stages of dementia without diagnosis. There are some staple signs to diagnose a person with Alzheimer's disease. Some primary or staple signs used to diagnose are confusion, delusion, hallucinations, and pathological features such as arteriosclerotic changes. When the arteriosclerotic changes happen, the arteries harden and the elasticity of the walls become weak. The blood flow is then restricted and the patient becomes confused. When the diagnosis of these dementia-like behaviors first came about, medical professionals diagnosed patients primarily with senile dementia for ages 45 to 65 only. In 1977, the term dementia became the diagnosis for all signs and all ages of people with dementia. Memory loss is a primary sign of dementia leading to Alzheimer's. When dementia-like signs are shown, medical professionals will look at tests to be ran and help understand the stage and the treatment options appropriate. Some common tests ran on patients for medical diagnosis are PET scans, MRIs, and cerebrospinal fluid proteins. PET scans use radioactive tracers to highlight amyloid proteins in the brain. When these proteins show up on the scan, it alerts the physician that the brain has poor cognition and Alzheimer's disease is suspected. MRI scans is a 3D scan of the brain. This scan can show atrophy or shrinkage of this number of cells, specifically in the hippocampus part of the brain. This scan can help determine an Alzheimer's diagnosis and is common when the behaviors are shown. This scan can also help determine the stage depending on the cell size and volume of the cells. When a physician diagnoses a patient with Alzheimer's disease, there are many treatment options to help minimize the symptoms to help enhance the quality of life for the patient. Treatment options are different for all stages. Medical professionals prescribe medications to decrease the symptoms even though there is not a cure. 3 of the most common inhibitors used to treat Alzheimer's disease are Aricept, Exelon, and Galantamine. Aricept is used for treatment of all ages. Exelon and galantamine are used to treat mild to moderate cases. Structured environment is also a way to help diagnose a patient to feel safe, comfortable, and the routine also helps decrease the behaviors and helps with restless sleep patterns. Orange essential oils are used with patients with poor appetite, and lavender is used when poor sleeping patterns are present. Essential oils, this is the orange, and is very good when used with a warm towel to put on put the oil on the towel and take it to the patient. People with dementia like tactile things, and the scent helps enhance their appetite, which helps with poor nutrition and things like that. There are multiple ways of treating Alzheimer's disease to help decrease one's symptoms. There is much research, continuing diagnostic tests, and education for caregivers that will continue to grow as this disease and diagnosed numbers begin to grow. The history of Alzheimer's disease begins again back in 1906. Since then, the numbers have rose to 3% in every billion people themselves are affected by Alzheimer's disease. There are many signs and symptoms, with memory loss being the primary. When you look around, there are many people of all ages that have been diagnosed or is living with this disease undiagnosed. I hope this information will help you understand this disease better and could help a friend, a person, or a family member or a caregiver cope. Always remember, do not ask me to remember. Don't try to make me understand. Let me rest and know you're with me. Kiss my cheek and hold my hand. I'm confused beyond your concepts. I am sad, sick, and lost. All I know is that I need you to be with me at all cost. Don't lose your patience with me. Don't scold, curse, or cry. I can't help the way I'm acting. Can't be different though I've tried. Just remember that I need you. That the best of me is gone. Please don't fail to stand beside me. Love me till my life is done. Thank you.